good morning everyone and welcome. It's so amazing to see you here and to have this warm sun on us today. My name is Norma Garcia and I'm honored to be here with you today on behalf of Mission Economic Development Agency, known as MEDA, where I serve as the organization's Policy Counsel and Director of Advocacy. We have a lot of our MEDA familia here today, as well as our allies, our comrades, our friends, and our family. I want to let you know we have a few speakers that we're very delighted to have with us. We have Supervisor Hillary Ronan from District 9. We're expecting Supervisor Shimon Walton from District 10. And we have Supervisor Dean Preston from District 5. Asha Safai from District 11 was going to join us but is unable to get out of a meeting. And so we're going to have our speakers, but first I want to tell you a little bit about what you can expect from us today. This morning we'll be unveiling the findings of a year-long project entitled Health Equity Through Housing. This project was undertaken with the support of a grant from the California Department of Public Health. And we were fortunate to have the support of Supervisor Ronan and the San Francisco Department of Public Health when we sought this grant. So the California Department of Public Health was very interested in learning about what may have been driving the unusually high infection rates amongst California's Latinos due to COVID. We knew that San Francisco's experience had a lot to contribute to a greater understanding in our state, and in fact nationally, about what drove infection rates in our community, and that San Francisco's Latino community has an incredible story to tell, how the community worked together to drive those infection rates down and vaccination rates way up. MEDA undertook this study because as a 50-year-old community economic development organization, we're deeply embedded in creating more affordable housing opportunities in San Francisco. We understand how critical housing is to health. We undertook this project to document the experience of San Francisco's hard-hit Latino community during some of our city's darkest days, to better inform policymakers and to support our community now and into the future. With a focus on 5 San Francisco neighborhoods, the Mission, the Excelsior, Visitation Valley, Bayview, and the Tenderloin, we investigated the connection between housing and the related social determinants of health and the disproportionate impact of COVID-19 on San Francisco's low-income Latino population. And here's what we found. COVID-19 merely lifted the veil on what happens when the social determinants of health are stacked against a vulnerable community in the face of a fierce disease. This project underscored that affordable, safe, and dignified housing is integral to health and well-being across generations, from babies to elders, especially for vulnerable communities. And it should be considered a public health imperative and nothing less. The report includes feedback from 261 survey respondents and 46 in-depth interviews conducted with the assistance of the Promotoras Activas de San Francisco. And our survey respondents, let me tell you a little bit about who they were. 79% either had COVID or lived with someone who tested positive. 91.3% lived in overcrowded conditions. 56% borrowed money during COVID to cover rent. 75% worked in low-wage, non-union jobs in conditions that made them more vulnerable to the pandemic and in frontline worker roles. So across the 5 neighborhoods, the participants reported some recurring themes. They suffered significant illness and stress and housing instability, especially for children. Overcrowding made it difficult to isolate and quarantine. And it was a result of housing unaffordability. I'll never forget one of the quotes I read, which was, "I'm afraid of giving or getting COVID." Constant fear. They worked in low-wage jobs requiring in-person presence that exposed them to a greater risk of infection. And they suffered economically, exacerbated by illness, layoffs, job losses. And they were forced to make difficult trade-offs between income for survival and getting infected. And there was a reluctance. There was a reluctance to obtain services to which they were entitled because they were afraid of being labeled as a public charge and the consequences that could flow from this. So we're honored this morning to have with us our supervisors who represent several of the neighborhoods in our study. And I'd like to invite them to the podium one by one. And after they speak, we're going to have Dora Mineros from Promotoras Activas. We have two amazing physicians with us, Dr. Ayana Bennett from the San Francisco Department of Public Health, Dr. Karina Marquez from UCSF, and then I'll give you a short description of some of the recommendations that came out of this process. And so now I'd like to invite Supervisor Hillary Ronan to the podium.
Thank you so much, Norma and MEDA, for always being there for the community. Your work is extraordinary, and we're so grateful to you for everything you do. We learned a lot during the COVID crisis about having different public health strategies for different communities. Not one strategy does not treat everyone equally if you apply it the same to everyone. And I think the partnership that developed early on in the COVID crisis between DPH, the Latino Task Force, and UCSF was extraordinary in not only showing us very early on that the Latino community was disproportionately impacted by the crisis, but by developing solutions to that inequity that were truly based in the community and therefore worked. What came out of the Latino Task Force was a program that I got the privilege of working on together with Santiago Lerma from my office, which was the Right to Recover program, which took all the inequities into consideration that Norma spoke about and created an intervention to give people who got sick with COVID wage replacement so that they could stay home from work and get better, protect others from the illness, and still afford to put food on the table for their families and pay their rent. That's the kind of intervention that happens when doctors and public health agencies work together with the community to craft particular solutions that help people. We need to continue to do that for all the other inequities that came forward in this report, to the continuing health inequities, to the housing inequities, to the school achievement inequities. I mean, the list goes on and on and on, because poverty, forced migration, these issues that are rampant in the Latino community require responses that are different and oftentimes more tailored to fit those communities, because these inequities are wrong and we have to do something about it. So I just want this community to know that this report is going to be taken very seriously, that it's going to help us guide our work going forward, and that we know that the interventions that work are the interventions that are crafted hand in hand with the community that we're serving. So thank you so much.
Thank you so much, Supervisor Ronan. You're absolutely right about the things that work and the need to do more of that, and the importance of working together with community. I'd now like to invite Supervisor Dean Preston to the podium. Thank you.
Thank you, Norma and MEDA and all the amazing advocates and activists who are here today. This is an incredible report. Encourage everyone to read it. And as my colleague, Supervisor Ronan said, I certainly hope that the entire Board of Supervisors, Mayor, and all leadership in the city will take these recommendations very seriously. There is no path to health, whether it is mental health, physical health. There is no path to health without stable, decent, and affordable housing. And what this report does is it breaks those silos where we talk about health and where we talk about housing, and we recognize that the two are integrally related. I am proud to represent District 5, which includes the Tenderloin, which is one of the areas in the study, and appreciate that that was included within the scope of this study. I want to really thank my colleague, Supervisor Ronan, who on every initiative around stabilizing people's housing, fighting for affordable housing, has been a champion, a leader, and an incredible partner here in City Hall, and I appreciate her for that. We have done a lot of things, and there's still a lot more to do. We have guaranteed a right to counsel in San Francisco through a ballot measure and through advocacy in City Hall to make sure that people facing eviction are represented so that they don't lose their homes. We have fought for eviction bans during the pandemic to make sure from the early days of the pandemic that the health crisis did not become an eviction crisis. And I'm proud to say that we stopped a lot of those evictions, but that work is not done. Those eviction bans will be expiring. The need for rent relief is as strong as ever. We have got to make sure that people who are affordably housed stay affordably housed. And then the last thing I will close on is to just remind everyone, and it's made so clear in this report, that for all the work and for all the advocacy, we are falling short as a city in creating deeply affordable housing. And we are succeeding in reaching our goals around and exceeding our goals in creating market rate housing. And so just looking at the last 8 years, we've hit 150% of our market rate housing goals. 150% of our market rate housing goals, and barely 50% of our affordable housing goals. But you wouldn't know that from reading the local newspapers, because they only want to talk about housing that is affordable to the top 10 or 20% of San Franciscans. What a report like this does, and what we all must do, is center the needs of low-income and working-class people, of people of color, especially of the Latino community here in San Francisco. We need to center those needs in our housing policy and stop obsessing with creating more and more luxury housing that nobody can afford except the very, very wealthy in San Francisco. So thank you for your partnership. Thank you for your hard work on this report. I look forward to making these recommendations a reality. Thank you.
So much, Supervisor Preston. Couldn't agree with you more. You know, this city was built by people of color, by working class people. They built this city and they keep it running. So let's not forget that. I'd like to introduce Supervisor Shaman Walton from Bayview. Thank you so much for joining us.
Well, first of all, good morning. I want to start off by thanking MEDA for the work in the research. I think it's really common sense that we understand that if folks have stable housing, if they have a place to stay where they can afford, that obviously they'll have better health outcomes, and we can address a lot of these health disparities. It's unfortunate that we have to continue to do research to get the answers to some of these problems when we know the solutions are right in front of us. That's to make sure people are housed and make sure that they can be in a stable environment. And so this information that we've received obviously is an important tool for us as policymakers and leaders in community to be able to respond to our neighborhoods. And as you can see from the report, certain areas in San Francisco, we have more instability than others. And that's why it's important that we see those instabilities so that we can address them. So I want to thank MEDA again for the research, and just want to say that my colleagues and I are going to be working hard to address those disparities and, of course, to attack the negative impacts of unstable home environments, which have led to a lot of our negative health disparities. And thank you all for coming here, and thank you all for caring and being concerned about this work, because it is important that we understand how stability or instability affects our health and leads to our negative health outcomes. Thank you.
Thank you so much for joining us, Supervisor Walton. It's great to have you here. I'd like to invite next to the podium Dr. Ayanna Bennett. She is the Chief Health Equity Officer and Director of the Office of Health Equity for the San Francisco Department of Public Health, and a champion for health equity and a leader. Thank you, Dr. Bennett.
Thank you all for being here. It's wonderful to see the support for this kind of work. We have learned well before COVID, but that lesson was spread to everybody during COVID, that we have to deal with people in their communities. We have to deal with those larger problems if we're ever going to find health equity for our community. People who are unstable in their housing are the same people struggling to find living wage jobs, are the same people having food insecurity, are the same people trying to find support and not for their children and their childcare. So we have complexity around what it is that people need and how to help them, and the only way to understand what to do is from the communities themselves, because the needs are different. And so having this kind of information from community is really important to us, and it's the kind of thing that will help direct better solutions in the future. And we respond to that by doing our part, which is helping to craft those solutions with community, hearing their voice in what we do, and giving them the information about their health that they need to make those kind of decisions. So thank you, MEDA, for this work, and for all the people who participated and told their stories. It's really important that you did that, and we appreciate your voice in these problems. Thank you.
Thank you, Dr. Bennett. I'd like to next invite to the podium Dr. Karina Marquez, who is an infectious disease physician and assistant professor of medicine at UCSF. She's also one of the principal drivers of Unidos en Salud, a very successful program which helped to address the critical needs of our community deep in the pandemic and now still. So Dr. Marquez, please.
Thank you so much. So I'm going to start with sharing 3 observations and reflections from the clinic and from working with the Latino community at the LTF Unidos en Salud COVID testing and vaccination site in the Mission District. And I think these themes are really captured well in this report, and there's a lot of solutions to address a lot of the things I'll be talking about. So just to sum it up, affordable and stable housing is the top issue for my patients. It is a social determinant of health. And if we really want to advance health equity, we must address housing. We need affordable housing. So 3 observations. 1, I'll start with the infectious disease observation first, because that's my specialty. But I think we saw firsthand very early on that crowded living conditions can really amplify infectious disease transmission. We saw the inequities in April 2020 in the first study from Unidos en Salud, and housing came to the forefront. I'll never forget one family who had a positive result. It was a man who, in his 70s, he was an immigrant, a Latino immigrant, and he lived in crowded conditions with many other families. And when he found out he tested positive, he was so afraid of transmitting his infection to his daughter with many health conditions that he essentially disappeared for a moment. And then through lots of care, trust, and follow-up with the community wellness team of the LTF, we discovered that he was staying in an abandoned building in the cold with not enough food. And eventually we got him food in a hotel, but I think this story really exemplifies many of the challenges that our community faces in the, throughout the pandemic. And I'd like to say that this is not exclusive to COVID. This winter we saw a rise in RSV, influenza, and COVID, and crowded conditions increase the risk of transmission to those who are most vulnerable, further amplifying disparities. And we're so grateful for Supervisor Ronan's Right to Recover that really helped address some of these problems. Second observation, housing and the impact, it deeply impacts mental health and chronic stress. The pandemic is not over, and the impact of job loss, missed rent, and utilities continues to hit our community hard. I can't tell you how often the stress of not being able to pay rent and the lack of resources for this come up in our clinic. And also important to recognize the impact on the families and our children, and the need for safe spaces to learn and grow. Lastly, unstable housing fuels disparities in chronic diseases. All healthcare providers can attest to the massive impact of housing on health. A recent patient of mine, I've been an HIV doctor for over 10 years. He was on the streets, then staying with friends, renting a space in a hallway, and it was really hard to be able to take his medications for HIV and diabetes. He often got his meds stolen, didn't have a place to store meds. And when he got housing, stable housing, his viral load was suppressed, his diabetes was controlled. Housing is medicine, and this is critical for the community. So just to close, there's a lot of talk about inequities, pandemic preparedness. Let's not repeat the mistakes of the past. Let's move towards action. I know many here, standing here, are already put into action many of the recommendations in the report. Let's choose social justice, let's choose affordable housing, and let's choose a more equitable future as we move on. This is critical to our recovery. Thank you for listening.
Thank you, Dr. Marquez. Housing is medicine. Take that in for a second. Right? That's amazing. That's amazing. Next, I'd like to invite Dora Mineros to the podium. Dora is a superstar. She is one of our movers and shakers in Promotoras Activas San Francisco. And Dora was instrumental in collecting surveys and doing interviews that formed the conclusions of this project. So I'd like to invite Dora and interpreter, Ariana.
Good morning, mi nombre es Dora Mineros y pertenezco, soy residente de San Francisco, vivo en el barrio de Bayview y trabajo con las promotoras activas de San Francisco junto con MEDA.
Hello, my name is Dora Mineros, and I am a resident of San Francisco in the Bayview neighborhood, a member of Promotoras Activas de San Francisco with MEDA.
Ok, quiero mencionar que es importante y triste, lamentable ver cómo las familias y adultos mayores enfrentan las dificultades de salud y vivienda a raíz de la pandemia.
I want to mention that it is sad and unfortunate to see how families and older adults face health and housing difficulties due to the pandemic.
Esto lo menciono porque ya se sabe que el hacinamiento es algo que nos impacta desde antes, ya era una realidad. Y a esto se le sumó que tenían que moverse por falta de pago, no podían pagar su renta a las familias. Y eso generó desgaste emocional en cada miembro de la familia.
I mention this because it is known that overcrowding is something that was a reality from before the pandemic, and then was added the stress on the families who could not pay rent.
También quiero mencionar que mediante las protecciones que se generaron en la pandemia y se implementaron, se logró detener muchos desalojos injustos que se generaron también a raíz de la pandemia.
I also want to mention that families obtained tenant protections that were implemented in the city with timely information, and that was a way to stop many unfair evictions that result through the pandemic.
Durante la pandemia hice varias labores para proteger la salud física y mental de nuestra comunidad.
During the pandemic, I did various tasks to protect the physical and mental health of our communities.
Desde el seguimiento y rastreo de contacto hasta trabajo de alcance para vacunación y mucho más. También fui una de las personas que entrevistó a miembros de la comunidad para este reporte.
From contact tracing work to tracking to vaccination outreach and much more, I was also one of the people who interviewed community members for this report.
Después de haber experimentado el impacto que generó la pandemia, es importante crear planes de prevención y mejores protecciones relacionadas a la vivienda.
After having experienced the impact generated by COVID-19, it is important to create prevention plans and better protections related to housing.
Especialmente para la comunidad de bajos ingresos y que no cuentan con un servicio de salud directo. También generar más oportunidades verdaderas para nuestros adultos mayores.
Especially for the low-income community and also for people who do not have direct access to health services. Real opportunities also for our older adults.
Por eso me uno como promotora de vivienda, salud y equidad a la demanda de oportunidades realmente asequibles de vivienda económica para nuestras familias.
And that's the reason why I joined the demand for truly affordable housing opportunities for our families and our communities.
So very grateful to you, Dora, for your work and your vision and your passion. You are what keeps us together. You keep us going. Thank you so much. We have a long road ahead of us. I'm so inspired by all of the words I heard shared with our speakers today, and I want to take a moment to just acknowledge some of the people who are here with us today. And if I miss you, please pardon me. But we got RSVPs from a number of organizations that you see here today. We have La Raza CRC here with us, Latino Task Force, the Women's Building, Mission Food Hub Carnaval, the Laura Street Community Services, the National Harm Reduction Coalition, Mission Neighborhood Health Centers, and the Native American Health Center, San Francisco Latino Parity and Equity Coalition. And I believe we have someone here from Scott Wiener's office, Mr. Omar Rincon, and others. And if I've missed you, my apologies, but I just want to take a moment to thank you for being here today. And thank you for all the work you do and all the work we do together. All right, I want to take a few moments just to give you a quick rundown of some of the community-driven solutions that came out as part of this process, as part of the surveys and the community meetings that we held. And Lucia Obregon right there, who used to be part of our MEDA policy team, did a lot of work on this project, as did Peter Papadopoulos, who's our stage manager running around our MEDA policy team. So some of the recommendations are these. Now, I just want to preface this with a little note that this is just a starting place. This is not the end all and the be all. This is a launch pad. And undoubtedly, the community will build upon these ideas and create new ones as time moves on. And so the first recommendation is to prioritize affordable housing and to create more housing for low-wage workers, so that San Francisco's low-wage workers can live in the city they serve. The next one is to provide permanent housing for unhoused individuals and families. And one of the revelations that came out of this work that we're doing here is that last fall, we learned that the Latino population in the unhoused community grew by 55% since the beginning of the pandemic. I mean, it was absolutely astounding. And so we have a whole other level of work to do, but this definitely ties into this recommendation. And the next one is to ensure that community residents have input into what is developed in their communities, that they have a say in their built environment, that they're involved in the planning process of what evolves and happens around them, because that is a critical element of cultural preservation, and it's a critical element of respect and honoring the people who are here, who work hard every day to keep this city going. The next is to protect tenants' rights and to increase access to information. As we heard from our speakers, this is something that we must continue to do. San Francisco is largely a city of renters. Our community members are largely renters. They keep this city going. We need to keep them here and make sure they're protected. The next is to establish living wage policies and programs for today's low-wage workers. There's nothing sadder than hearing that somebody works 2 full-time jobs and still worries about paying their rent and feeding their children. What is that about? We need to address this. The next is to align workforce development with the future of work after COVID-19. What we're learning from the research is that the labor and employment landscape is going to be shifting. And so how do we make sure that our community is trained and ready to take advantage of those opportunities? We talk about that more in this report. And finally, and this is to all of you here, the community says that it's essential to support community-based organizations and healthcare workers and others who coordinate to provide culturally competent, essential services to vulnerable populations. Those are the recommendations. There's a lot we can do with that. And so now we're come to our closing. We're right on time. On behalf of MEDA, I want to thank you all for being here and for all the work you do and for all the work that's left for us to do. And personally, this is very important to me as well as a kid from the Mission who went to school down the street at that law school. To be here, fight for this, and to be here with you. Please go to our website, download the report, share it with your colleagues and community, share it on social media, engage in dialogue. Let's get out of this pandemic better than when we went into it. And let's continue to move forward together. Thank you.